So this study was conducted in the last 2 weeks of April, first week of May, over 3 weeks period, where we disseminated a questionnaire of 50 validated questions to our collaborators globally. And we were able to recruit 356 centers from 54 countries in 6 continents. And actually this, the survey was asking about, what was the impact of COVID-19 on the cancer care? What are the challenges that were faced by the cancer centers? And what are the interventions that they're taking care of in order to overcome these challenges? And the estimated potential harms and the reason for harms, if you will, to cancer patients. So we found out that actually the majority of the cancer centers, 88% of them, did face somehow some kind of challenge in managing cancer patients during the pandemic. And we can get into more details on that. So these centers actually represent different kind of healthcare sectors in these countries. There are governmental hospitals, private hospitals, as well as academic centers. They were standalone cancer centers, as well as centers which are part of a bigger organization. There were small centers, they see less than 1,000 patients a year, new patients a year, to large centers seeing more than 10,000 patients a year. So it was actually kind of mixed. That is, that gives you, a good idea about the different settings. And it was also from different countries, which also has different, as you can imagine, different income and socioeconomic status. We asked them, did you face a challenge of cancer care? 88%, as I said, they said yes, or the question was specifically to try to clarify that. What were the reasons that you altered the usual standard care that you used to deliver to your patients? 55% of the centers said that we did that preemptively as precautionary measures. Because, the oncologist felt that, cancer patients are vulnerable population, that, the COVID-19 is a new virus that was, we did not know the magnitude and impact that could happen, to our cancer patients. So many of the centers did that preemptively, precautionary measures, by reducing the visits, switching to other things, to virtual visits. We'll talk about that if we get a chance. However, there are other causes that are of concern. For example, about 20%, 1 out of 5 centers said because the system was overwhelmed healthcare system with the flood of COVID-19 patients. Of course, the shift has to switch to acute care, and the resources has to be switched. People sometimes think about resources, just the ventilators or ICU, but it's much more than that. It's the staff also. It's the focus of laboratory imaging, everything switch. So when you get overwhelmed system, then the cold cases, if you will, the cancer cases will be taking second priority. And then there are other, almost again around the same percentage said it's lack of PPEs. They did not have enough personal protective equipment. And actually around 46% of the centers, they said they have some of PPE shortage, specifically N95 and so on. So, and then there was like 10% of the center said it's because we had lack of access to medications and so on. Because, even the flow of supplies, the supply chain also get interrupted. And maybe the medications don't get delivered to the centers on time and so on. Yeah, so we did, and you will see that in the paper that's coming in the Journal of Global Oncology later on in this month or earlier next month, where we have the table where we mentioned the countries based on the stratification by the World Bank, low income, middle income, and high income countries. And yes, the impact on the low income and middle income was higher. So for example, shortage of PPE was more likely to happen in low income countries. So there was some disparities. Well, we concluded that, this pandemic impacted cancer care globally, and, in affluent countries and in poor countries to a varying degree, as you can imagine. And that, impacted the delivery of cancer care probably for a long term. Unfortunately, there is a loss of life and potential patients' harm that happen immediately, and probably there is other harm that we are going to recognize as the pandemic evolves. But there is a change in the practice that already took place, and that is going to last for a long time. For example, switching to virtual clinic, virtual patients visitation. Almost 70 plus, did have physical versus virtual, and another 8. So 80% of the centers use virtual technology to visit with their patients. And about 60% of the participants believe that this is going to stay, after the pandemic. There is also the second change, which was accelerated by the pandemic, is pushing to delivery of care, remote care near patients' home. So you find more centers are shipping the medications to patients' home or doing lab tests near patients' home and so on. So there is some silver lining to this, which is probably cutting some of the waste. Probably we were seeing many patients that they did not to be seen that frequently, or we could have saved them time if we check on them by phone or by video, and we bring them in only if it's needed. So there is some positive effect. Nevertheless, the harm is widespread and too costly, actually. Of course, the issue is what are the lessons that we learn to the future. That's very important. And we have a free text question that left in the end, for the participant to express what should be done in the future or in preparation of the future. And majority said, we should have really preparedness plan and be always ready to such crises, stock enough on PPEs, stock enough on medications, and so on. So I hope this pandemic will finish soon with the least possible casualty, but we should always be prepared, whether a second wave of this or other pandemics or other crises, which may not be at the same magnitude of COVID, but so sometimes single institution may face certain crises, and actually these lessons learned from COVID-19 may help the centers manage this any crisis in the future better. Like for example, in our centers, because we were epicenter in the MERS-CoV crisis. So we have so many plans, so many processes, and so on, that we were able to quickly respond to this and try to learn from lessons in the past. However, the difference here is that COVID-19 is much widespread. It has a higher infectious rate, although the mortality is less, but the fact that it has higher infectious rate, make the number of people overwhelming. And that's why we implemented the new things that was not as commonly noticed in the past, such as social distancing. So this was emphasized in this crisis more than the others.